I'm Dr. John Demshar, and I'm the Clinical Director for Lions in Sight. Today what I'd like to talk about is lead doc responsibilities. These are the responsibilities that the lead doc needs to know in order to make this a successful clinic. When you get to the site, the doc's bag will show up. It'll be brought by one of the people who transports it from Northern California. It becomes your responsibility. It can be left at the clinic site only if the site is secure. If not, the doc's bag needs to be packed up and returned to the hotel with the autorefractors. Next, let's move to the setting up of the clinical site. This should be done prior to the clinic on Thursday evening on a 4-day clinic if possible. If not, you'll have to do this on Friday morning. On our week-long clinics, we like to set this up on Sunday. You'll have plenty of time to set it up and get it ready for Monday morning. The next big item is a referral table. This needs to be discussed with the head lion prior to the clinic day. Most Lions clubs will have referrals for cataracts and glaucoma, however not all for high RXs. If there's high RXs to be determined, many times we can write those, but the local Lions may or may not be able to do that. We can give the patient what we call a frame only, and if the Lions manage to make this happen, they can get lenses for these frames for these patients. They will be responsible for getting a hold of the patient. You need to meet at 7 o'clock in the morning for breakfast. You have to leave at 7:30, and you need to be at the clinic site by 8 o'clock. This is imperative. If you don't start at 8 o'clock, if you don't get started till 9:30, then you're going to be working till 7 o'clock at night, and nobody will be happy with you as a lead doc. On 4-day clinics, we usually have 400 to 600 forms per day. On week-long clinics, 8 to 1,000 per day. And these forms are given out to the local Lions 100 at a time. There's a reason for this. If you give them 400 forms, and these are different colored forms, they'll have pink forms, green forms, goldenrod forms, and you'll be seeing all sorts of colors all day long. What you need to do is give them 100 green forms. Once those forms have come through, give them another 100 in pink. Somewhere along the line at about 2 hours, you can actually count the number of forms that have come through and determine how fast your team is working. If your team is seeing 100 forms through 2 hours, that's 50 an hour, then you're going to be seeing about 400 people that day, 8 times 50. So that means you're going to need to pick it up. So you have to watch as lead doc to see how fast these forms are coming through. And the colors will help you. Just on site, you can see what colors are coming through. Another area that's very critical. A lot of these clinics we get to, the history will come to the doctor and it will be can't see, blurred vision. What we need to know is, what's the problem? I can't see far, I can't see distance, or I can't see near or close up. This needs to be on the chief complaint. So as the lead doc, if this is not happening, you need to get with the history takers and make sure that you insist that they get this history taken properly. It saves us a lot of time in the trenches. It's best to take lunch in shifts. You're going to send half your docs and half your techs at one time for 15 or 30 minutes. Then we're going to turn around when they're done and send the rest. If you all take an hour and a half like some of the Lions clubs like you to do, then you're going to be working until 7 or 8 o'clock at night and nobody's going to like you for this. So that's the best thing to do because you don't want people to be sitting there watching you eat. Keep the clinic moving. Casual, however, no shorts or tank tops. If one of your people shows up with tank tops or shorts, send them back so that they can put the proper clothes on. Sometimes you can do the procedures on Thursday evening before the clinic. Go over all clinic procedures with all your staff, especially the new people, because this is their first time, they won't know what's going on, and that has to be taken care of. If there's any questions, you can answer them then. We have a bag of high-plus lenses in the doctor's bag. Invariably, these lenses get stuck in the dispensary and they get lost. High-plus lenses are hard to come by, and we need to make sure that we bring those back. So if you have a person that needs a plus 14, dispense it yourself. Keep the bag in the doc's area. When you get to the clinic site, you'll open the doc's bag up, and on the very top of this will be this manila envelope, and there's some very important forms in here. The first one is an authorization to get this equipment into Mexico. There's also a certificate of registration in here. And there's a list of equipment right here in English and Spanish. Many times you'll go right through customs, you won't even need these forms. But there are times when you get to the customs department and they want to see these forms, and they'll tear this bag apart, making sure that everything that is on that list is in this bag and vice versa. So there are times when you're going to get hassled. We also have 10 LIS patches in here, and these will be given away at the Saturday evening party to the lions who have helped you the most. So keep that somewhere handy. First of all, we're going to unpack this bag to show you what's in here, and what you want to be able to do is put it back the same way you took it out. These are acuity charts. There's about 10 to 12 of these in here, and they'll be put up on the walls so that people can look at those while you're doing the exam. Here's an LAS banner similar to this one. You'll put this up at the entry to the clinic so everyone can see who we are. We have a lot of hand towels here to put on your table for the doctors so that your retinoscopes don't roll off the table. If it's 120 degrees, it's nice to have something to wipe the sweat off your brow. There's a bag of these cleaning cloths that are used in the dispensary to clean glasses with. A bag of pens, always necessary. Here's some flippers to be used in the dispensary. These are nice to have because if you put a +1 on a patient and they say it's not good enough, as a dispenser you really don't know which way to go, whether to go to 1.5 or lower. If you have these flippers, you can actually go +1/2 more, -1/2. That will tell you which direction to go. Saves you walking time from the dispensary to the glasses, okay? So that's handy. There's a bag of high plus lenses that will stay in the doctor's bag. These are hard to come by. They don't make these anymore. So these will stay with the doctor's bag. The doctors will dispense them out of that bag. Don't let it get to the dispensary because it'll never make it back. We have a first aid kit. Never know when you're going to need that. We have 2 lensometers so that if a patient is wearing glasses, you can figure out what they're wearing. We have 2 tonometers so that if patients you think might have glaucoma, you can check the pressure with those. Now you'll notice we have 2 of a lot of things. There are usually 2 doctors' tables, 2 doctors at a table. Each table will have 1 of these, 1 of these. So that's why there's a lot of duplication on this equipment. We have alcohol pads. Some of the equipment we use needs to be cleaned after we use it. The roll of toilet paper, extremely handy because when you put drops in a patient's eye, you have to be able to give them something to wipe it with, and these are handier than a box of Kleenex. Duct tape is invaluable. You can put black plastic on the windows to keep the light out, so that's a very handy item. The batteries that come, most of these will be tossed before you leave. We don't want to bring back old batteries. Now we have 2 of these sets of +1.5, +2, and +250 lenses. These are very handy for determining a reading prescription. If the patient needs a 2, you put 2 up. If it's too much, 1.5. Not enough, 2.5. 1 for each table. We have these little handheld slit lamps. These are wonderful little tools. You can use these to actually determine whether a patient has a cataract or not. This is what we use mostly, but we also have one that actually attaches to your Welsh Allen ophthalmoscope battery handle. You'll have 4 sets of retinoscope, ophthalmoscope. You'll have these handheld lens bars that you can use to determine the prescription once you've figured out with retinoscopy what you want to give them. Then we have a box of dispensing equipment, all kinds of hand tools, screwdrivers and whatnot in there. That will go straight to the dispensary. And then you have a doc's bag or box. This is full of antibiotic, anti-inflammatory drops, diagnostic drops, and also a 20 diopter condensing lens. These are expensive, so make sure that that gets back in there. We have a couple forms here that describe dry eyes, pinguecula and pterygium. We have these in Spanish for our Spanish trips. Sometimes it's handy to give that to the patient so that they have a little bit more information about what their problem is. We also have artificial tears, and everybody likes to have hand sanitizer. Now, what's important about packing this doc's bag is we got to make sure that all of this equipment, expensive equipment, gets back into this bag. And that's why we want to talk about packing this. Now, the clinic's over, everybody's dead tired, and the only thing they think about is tossing it back in and getting the heck out and having a beer. Can't do that. The docs at the tables should pack their stuff up, bring it to the lead doc. The lead doc should concentrate on getting it back into the bag in some order. As long as that doctor makes sure that everything is in here, I'm not too concerned about how organized it is coming back. But this makes it easier when you do it this way. So we've got the doc's box, the dispensing box. We're going to put the 4 ophthalmoscope retinoscopes back in. 2 of these for each doc. That's 8. These 2 lenses go back in here. These are the 2 slit lamps. Remember, we had 2 different ones in this set. Those are very important. The other side of the bag, we're going to put the 2 lensometers back in here. We're going to put the 2 tonometers back in here. And the reason I can do this so easily is because I've done 110 of these clinics, so you don't have to get it this organized, but just make sure you get it all back in here. First aid kit, whatever's left of the hand sanitizer. The high plus lenses, should be quite a few of those left. And then assorted things like pencils, lens cleaners, duct tape. You never know how much of that you're going to use. Things like lens swabs. You try to get back in the bag if they're there. If we run out of them, we're not that concerned. The flippers, make sure you get the dispensing flippers and the flippers that are for the doctors. And by the way, one thing I didn't mention is in the doc's box is 1 extra ophthalmoscope head, 1 extra retinoscope head, and extra bulbs in case these things break. It's always nice to have that. I've never had to use one, but they're there. Here's the other flippers right here. The dry eye and pinguecula forms. These drops will probably never come back. They're artificial drops. You'll use them all. Once again, very importantly, that banner got to come back. And all the acuity forms that are stuck on the wall, bring those back and bring this back. So basically we've got everything back in the bag. Some of the disposable items won't be totally returned, but the big items will. By getting this all back in the bag, this helps reduce the cost of us putting these clinics on. So we appreciate your help in putting this bag back in order. And by the way, this particular bag, the equipment in here is worth about $13,000. So it's extremely important that this bag is given to the person who brought it so that they can bring it back to LIS, either ship it to the warehouse or deliver it to someone who can bring it back. The other item is that this bag has to weigh less than 50 pounds. If you get to the airport and it weighs 51 pounds, they're going to charge you extra for this bag, up to $100. So we try our best to keep it under 48, 47 pounds. If for some reason their scale is off and it weighs over 50 pounds, you can pull off one of the retinoscopes right out of the bag, put it in your carry-on luggage, and then put the bag back up and it will go. So if that happens, do your best. Thank you very much.